My name is Alafia Samuels. I would like to welcome all of you to this implementation workshop of the evaluation of the 2007 Port of Spain Declaration. The heads of government of CARICOM in Port of Spain 8 years ago met and signed this landmark declaration, first in the world that heads of government had done so, and this led in part to the United Nations calling heads of governments together to address NCDs in 2011. So why are we here today? The NCD burden in the Caribbean is the worst in the region of the Americas, and in the Caribbean, Trinidad and Tobago has the highest rate of NCD mortality and the highest rate of premature NCD mortality in the region, people dying between 30 and 69 years of age. This is unsustainable from both the health and development perspective. Our response must be evidence-informed from a transparent assessment process. We need to set priorities together, health and non-health, public, private, civil society. We need to make recommendations and to monitor what we are doing to see the impact of our programs. Have we reduced high blood pressure? Have we stopped the increase in diabetes? Are there fewer people dying prematurely from NCDs? You have before you evidence briefs from the Port of Spain Evaluation Group, which aim to give a sense of where we are now. These results need your stamp of approval, which is one reason why we are here. So you can tell us, the researchers, if we got it right, if we missed important things, and so we can have a shared understanding. Then we want you to help us write the skeleton and core elements of an outcome-focused NCD plan for the years 2016 to 2025. We recognize that this plan needs to be adequately resourced, so one of our work groups will be looking at that topic. I just want to apologize because I didn't start the meeting in the right way. Protocol was not observed, so if you will excuse me, let me reverse and observe the protocol. Mr. Minister of Health. Honorable Terence Dayal Singh, thank you for coming. Welcome. I want to also welcome the other members of the opening ceremony team. Dr. Zee Leung on the far left, he's the IDRC representative, who are the funders of this exercise. Then beside him is Dr. Rudy Cummings, who is the representative of PAHO. I already introduced CARICOM, sorry. I already introduced the Minister of Health, and the PAHO representative is Mrs. Jessie Schultz-Aim. I'd also like to especially welcome Honorable Donville Innes, who is the Minister of Industry, International Business and Commerce from Barbados, and all other distinguished ladies and gentlemen. Good morning. So as I prematurely started saying, that's the theme of the workshop, premature. So premature mortality is really the important reason why we're here, because we're all going to die of something, right? And hopefully it will be a chronic disease, but we want to do that at age 90, not at 45. So it's about premature mortality. So we need to unite to stop the epidemic of NCDs within the context of the Caribbean Cooperation in Health, which just concluded their planning meeting yesterday. The 2016 to 2025 roadmap and priority recommendations have to be approved by CMOs in April, Ministers of Health in May, and heads of government in July. So we thank you all for being here. I hope we have a productive 2 days, come up with a strong action plan and priority recommendations so we can really save some lives, especially those who are dying too young. Thank you. Next, I would like to introduce Dr. Rudy Cummings. He is the Program Manager, Health Sector Development in the Director of Health of Human and Social Development at the CARICOM Secretariat in Guyana. He's currently responsible for coordinating CCH, which I just mentioned, and is the Principal Health Officer in the Caribbean Community Secretariat. He provides policy guidance to the Secretary General, provides technical and policy support to the Ministerial Council on Human and Social Development, and participates in the interdisciplinary agenda of the Secretariat. Dr. Cummings.
Thank you very much, Madam Chairperson. When I said to you yesterday, that's why you're a teacher and I am a civil servant, you rebuked me. But I think we're all overwhelmed by this event, and let me start off by Honorable Minister of Health. The Honorable Terence Dayal Singh, Minister of Health, Trinidad and Tobago, Mrs. Jessie Shutain, the PAHO Regional Coordinator, Dr. Z. Leung, the IDRC representative, Honorable Don Villenis, with whom we have worked, James Hospitalis and I, on some of these very tacky matters that carries this agenda forward, distinguished guests, colleagues, ladies and gentlemen, members of the press. I bring greetings today from the CARICOM Secretary General, His Excellency Ambassador Irvin LaRocque, and my boss, His Excellency Ambassador Dr. Douglas Slater, the Assistant Secretary General. I want to let out a sigh of relief as these 2 days will mark a milestone for the Port of Spain Declaration evaluation. When the heads proclaimed that famous declaration in August 2007, this event represented a key evaluation marker. And we did not know how it would happen, but it has, with the dedication of a core group of persons and support from IDRC. The Port of Spain Declaration has challenged us really for the first time to create multi-sector involvement in health. I believe that it was only possible to be birthed because of the words, PM, only you in your leadership role can pull together all the sectors to make a genuine impact on this scourge of NCDs. I'm paraphrasing Sir George Allen. The seeds for the Port of Spain Declaration were laid at the 2006 meeting of heads of government here in Port of Spain, when, having assimilated the NCD challenges outlined in that seminal report of the Caribbean Commission on Health and Development, Prime Minister Manning agreed to pursue a regional summit. Whilst it was a first for our region, in our region, for the heads to speak collectively to health, as they did in Nassau, Bahamas in 2011, proclaiming the health of the region as the wealth of the region, and identifying NCDs, along with HIV and mental health, as super priority challenges to be addressed. It was the report of the Commission of Health and Development that provided the evidence and gave traction to the Port of Spain Declaration. The convener of that commission was Sir George Allen, and he played no small role in convincing Prime Ministers Manning, Arthur, Douglas to embrace a high-level intervention in the form of a summit of heads. As you know, the story of how this declaration vaunted the Caribbean to public health prominence. The Commonwealth Heads of Government meeting in 2009 and the UN High-Level meeting in 2011. At every step, there were critical Caribbean nationals trumpeting this historic declaration. NCDs are now globally recognized as a leading cause of premature death globally, and it is clear that influencing its leading precursors, tobacco, diet, exercise, and alcohol, require more than health sector leadership. It requires leadership at the highest level, as now demonstrated in the USA, Australia, Uruguay, Canada, and the European Union. This declaration provided us with a challenge of how the health sector would work with other sectors, and this meeting will give an insight as to whether we mastered that art. We do have capacity problems in this regard. I am certain we will hear of some of the achievements, the CARICOM NCD plan, treatment protocols, NCD capacity instruments, tobacco labeling standards, and the institution of Caribbean Wellness Day, to name a few. NCDs are now in most country development plans. It features in the CARICOM strategic plan as the first priority in social development, and it has gained reflection at the global level among the Sustainable Development Goals. Besides Sir George Allen and his indomitable leadership, I want to pay homage to Dr. Lafayette Samuels, whose zeal for NCDs has kept interest in them growing strongly in CARICOM. to Dr. James Hospitalis for the role he played from his desk at PAHO in making the Port of Spain Declaration happen, and to his continued leadership at CARFA as its executive director. And finally, to Dr. Karen Seeley for her role as the UN liaison, as the WHO liaison to the UN during the lead-up to the UN high-level meeting. I have fond memories for all kinds of good health actions in Port of Spain, from the Health Promotion Charter to the work done for Caribbean Cooperation in Health to the Port of Spain Declaration. And I believe if we put our heads together well, that we certainly will do some good work over the 2 days. I look forward to hearing the results of the study, as it will inform the approach to NCDs in the new Caribbean Cooperation in Health 4, which began its formal evolution in this room over the previous 2 days. I thank you very much.
Thank you very much, Dr. Cummings. And now I'd like to introduce you to Mrs. Jessie Schutt-Ain. Jessie is a Caribbean Sub-Regional Program Coordinator at PAHO since August 2015. This office has responsibility for technical cooperation in support of regional integration mechanisms and liaises closely with CARICOM and CARFA, as well as other regional institutions. Mrs. Schutt-Ain has had 25 years of experience in global public health, particularly in the areas of HIV and adolescent health, and has earned her MPH and Master's in International Affairs at Columbia University. She previously worked at the World Health Organization in the Office of the Assistant Director General for Family, Women, and Children's Health, where she managed an initiative under the UN Secretary General's Global Strategy for Women and Children's Health and the Every Woman, Every Child movement. Jessie.
Good morning, and thank you for the introduction. Protocol having been observed, I'd like to simply acknowledge the Honorable Minister Terence Dale Singh from Trinidad and Tobago, Dr. Rudy Cummings, CARICOM representative, Dr. Z. Young from IDRC, and Dr. Alafia Samuels from University of West Indies. I'm pleased to be here this morning to represent PAHO and to represent our director, Dr. Carissa Etienne, who's been a fervent supporter of the NCD agenda. We're here to celebrate the Port of Spain Declaration and its evaluation. As we all know, 10 years ago, we came together in an unprecedented regional summit on NCDs, an example of Caribbean cooperation at its best, coming together to address a joint health problem. The Caribbean has the highest rates of premature death from the 4 major NCDs. That is diabetes, diseases of the heart, cancer, and chronic respiratory diseases. 3 of every 4 deaths are due to these illnesses. And 73% of all deaths occur prematurely in people between the ages of 30 and 69 years. NCDs are crippling our economy, our productivity, and our health. In order to tackle NCDs, we need to address the 4 common risk factors. That is tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. We need to introduce laws, regulation, and taxation aimed at reducing the use of tobacco, alcohol, sugar, and salt. We need to instill healthy living, healthy eating, and exercise in young people in order to prevent a future generation of Caribbean people suffering from diseases that are preventable. We need a whole of government and a whole of society approach, bringing together health, trade, agriculture, food industry, education, and other sectors to effectively address NCDs and the related risk factors. We need civil society, school, churches, communities working together towards this common goal. At PAHO and WHO, tackling non-communicable diseases is a key pillar of our work and our technical cooperation. We have a WHO Global NCD Action Plan, which sets out concrete targets and actions to reduce NCDs by 25%. PAHO has a plan of action on the prevention and control of NCDs, which reinforces the global and regional commitments. There's a plan for the prevention of obesity in children and adolescents approved by PAHO member states in the Americas to protect young people from obesity. In June of last year, PAHO and the government of Barbados organized a key stakeholder meeting to advance the NCD agenda in the Caribbean. Ministers of Health came together and concluded the meeting with a reaffirmation of commitment statement to achieve the 27 commitments of the Port of Spain Declaration. Now is time to accelerate our action, and I'm glad to know that an action plan is an aim of this two-day meeting that we're here for today. We've just completed, as was mentioned, a two-day meeting on the evaluation of CARICOM's Caribbean Cooperation in Health. CCH, as we all know, is a framework and a vision for health for the Caribbean. It informs sub-regional, national, and institutional health sector plans. And in essence, CCH is about bringing together Caribbean people and partners together to jointly tackle our common health problems and promote a healthy Caribbean. We had an exciting and fruitful 2 days. Participants included chief medical officers from the Caribbean, as well as civil society, UN partners, donor development partners. We also brought in other sectors such as trade and economics as their key to the response. We set the priorities in these 2 days for the new CCH, as Dr. Cummins mentioned, and we established the roadmap for development of CCH4 so that the CARICOM ministers in health can endorse that plan in September of this year. It's not a coincidence that these two meetings are being held back to back, as NCDs is one of the key pillars of CCH, and the evaluation of the CCH as well as the meeting concluded that NCDs will remain a key priority moving forward. The results of this meeting that we're about to start will feed into the Caribbean cooperation in health for the next 5 years. The evaluation of the Port of Spain Declaration is an exciting moment and opportunity for us all. We have the opportunity to look back, reflect, and accelerate implementation through an action plan that we will write at this meeting. We all have the opportunity today and tomorrow to take action and to make a difference. I'm happy to see that we have different sectors represented here today, because it's an all-sector approach that we need, and we need strong partnership and genuine collaboration to make this happen. This issue is too important for us to give less than our energy and enthusiasm and expertise. I thank you all for your time, and I wish us all an excellent meeting. Thank you.
Thank you, Jessie. And now I'd like to introduce Dr. Z. Leung. He's the Program Officer, Food, Environment and Health for the International Development Research Center based in Ottawa, Canada. As we mentioned before, the IDRC has funded this research and workshop. Z is a veterinarian and public health practitioner. He specializes in global health, particularly related to the intersection of human, environmental, and animal health and sustainable development. The Food, Environment, and Health Program strives to improve global health, particularly for women and children, by generating evidence, innovations, and policies to tackle preventable, non-communicable diseases and infectious diseases. Prior to joining IDRC, Z worked for the provincial and federal governments in Canada on a number of initiatives, including national surveillance for antimicrobial resistance, intersectoral approaches to public health governance, and research on the links between Crohn's disease and food and environmental risk factors. Z, if you could come and give your remarks. Thank you.
Thank you very much, Madam Chairwoman. Thank you to the Honourable Minister, Mrs. Schutte, Dr. Cummings, and thank you all for coming here, distinguished guests and colleagues. Thanks to Nigel and Dr. Lafayette and her team for bringing us all together. we at IDRC, we are very proud of the work that Dr. Nigel and his team is doing for this project. And I know that there's been a lot accomplished and a rich body of evidence that we are discussing over the next couple of days, so I'll keep my words brief. But I guess I just wanted to give a few words about IDRC, our agency, and how it aligns with some of the work that this project is accomplishing. IDRC, the International Development Research Centre, is a central part of Canada's international cooperation envelope. And we have a special mandate of supporting global development through research that's really led by Southern researchers. We do this by taking action, taking strategic action where we can achieve global impact through fostering innovation and leadership, through building multi-sectoral, multidisciplinary, and multi-country research partnerships. We have a number of areas of work. We strive to take action on poverty reduction, tackling social challenges, improving governance, and improving the health and livelihoods of vulnerable populations. And some of the driving themes which underlie the work that we support is in terms of really delivering research impact at a wide scale, identifying new research leaders and supporting the growth and capacity building of emerging leaders in the research and practitioners field, and bringing together groups from multiple stakeholders and multiple groups to really take action and take to scale innovations that can only be achieved through partnership. And it is these themes that I think are really emblematic of the work that Nigel and his team are really accomplishing today by tackling and targeting such a critically relevant issue of the rising and significant burden of non-communicable diseases in this region. And the approach in which they're taking, in which policy action and policy coherence offers so much promise for delivering regional impact with potential for scalability and transferability to other regions. So what lessons can we learn in other regions on how NCD policies and actions can actually be effectively implemented and cohered? It is through really the diversity and membership of the groups in this room, which symbolize the multi-sectoral, cross-country, multidisciplinary communications that Nigel has been able to bring about. And we know in public health that it is only through this whole of government approach, multi-sectoral action, that we can really achieve results. And it is through the communication and relationships that we build through this room and through this project over the course that we can really achieve much success. IDRC, we are pleased to also to have Nigel expand the work of this Port of Spain evaluation to now include taxation policies around sugar-sweetened beverages. And so we're excited to see the exciting results that come from that. But I think I'll leave it at that. I'm just very excited to be here and looking forward to the next 2 days of very productive and fruitful discussions. Thank you.
Thank you very much, C. I'd like to introduce the Honourable Minister of Health, Terence D.L. Singh, Member of Parliament for St. Joseph in the Republic of Trinidad and Tobago. As Minister of Health, Terence D.L. Singh's main goal is to make 3 highs, blood pressure, sugar, and cholesterol, into the 3 lows. And if you know me, you know he's talking my language exactly. Mr. D.L. Singh holds a diploma in pharmacy at the University of the West Indies and subsequently earned a postgraduate diploma in international marketing from the Chartered Institute of Marketing in the United Kingdom, before returning to UWI in 2007 to obtain a bachelor's in science, and in 2013, a Bachelor of Laws, LLB, from the University of London. Before entering politics, he lectured at the Institute of Training and Development and served as a part-time lecturer in the School of Pharmacy. During his tenure, In the Parliament, he has served on the Standing Orders Committee of the Senate, as well as on the Finance Committee. And I'm very pleased to introduce him as a dedicated NCD fighter.
Lesson number one, wherever there's a gap, don't be afraid to lead. Dr. Alethea Samuels, Chairman, CARICOM Representative Dr. Rudy Cummins, PAHO Representative Mrs. Jessie Schutte-Ain, IDRC Representative Dr. Zeal Young, and most importantly, he's the funder of today's activities. So he should really be giving the feature address. Honorable Donville Innes, Minister of Government in Barbados, Minister of Industry, International Business and Commerce, and I think a former Minister of Health. Yes. Great. Dr. James Hospitalis, CARFA, Dr. Patrick Martin, Chief Medical Officer, St. Kitts and Nevis, I believe is here with us. Permanent Secretary, Ministry of Health, Ms. Donna Faraz. Two things. I wear size 11 shoes. What's the importance of that, you may ask? I have a habit of putting my foot in my mouth, and today is going to be absolutely no exception. Because wherever there's an inconvenient truth to be told, you must not back away from it. Two, since assuming the role of minister, I have never, ever been introduced correctly. My name is correct, Terence Dial Singh. The honorific, honorable, temporarily I will hold that. I am a minister. I am from Trinidad, but I am not the Minister of Health. Because what I have found is that I am the Minister of Health Care. Trinidad and Tobago has spent $40 billion in health care from 2005 to 2016. But are we healthier? The answer is no, and that's where I put my foot in my mouth. I am the Minister of Health Care. I am the Minister of providing scalpels to amputate legs. I am the Minister of providing anti-diabetic drugs, health care. I am the Minister of providing statins, free health care. I am the Minister of providing methyl dopa, health care. I am the Minister of providing anti-cancer drugs to combat lung cancer due to lifestyle diseases, health care. That is what I am. I am not the Minister of Health. There is an inconvenient truth to be told. And this is what I think the heads of government did in 2008, was it? 2007. They recognized that in the Caribbean, if we do not face up as a society and a region to this inconvenient truth, what we have today is people dying before the age of 70 due to lifestyle diseases. So in spending $40 billion from 2005 to 2016, and we have Professor Carl Theodore here, professor in health economics, who could tell you that all of that money has been wasted. Because we amputate more legs today than we did 20 years ago. If as a society we had paid attention to the Framingham study out of Boston, we would not be in the position that we are in today. But we don't have to go to Boston for solutions. When we did our own St. James study in the 1990s in Trinidad, Dr. Hospitalis will know about that. If we had paid attention to the St. James study, which tracked diabetes and hypertension, and paid attention to that study 20 years ago, we would not be in the position that we are in today. But we have this impression that we must provide health care to the population. The population demands health care. I heard on the radio yesterday somebody advocating that the government of Trinidad and Tobago should now provide stem cell treatment. Government can't provide all these things for free. We have to decide what model of healthcare we want for our society. And if I have to stick true to my title as Minister of Health, not Healthcare, the Port of Spain Declaration speaks to that. If I am to be the Minister of Health, we have to have an intervention with children in the schools. And we have started that conversation with the soft drink manufacturers to come to us with voluntary cuts in sugar limits to drinks sold in schools. Because if I am the Minister of Health for the obese diabetic child today, I don't have to be the Minister of Health Care for that same child 20 years from now when they present our hospital to chop off their legs because they have uncontrolled diabetes. You see the difference I'm trying to make? From moving from being Minister of Health Care to Minister of Health. But the intervention that is needed is greater than our collective abilities so far. Because in Trinidad and Tobago, at least, we have made absolutely little or no progress in controlling the epidemic of diabetes, hypertension, high cholesterol. Those are the 3 highs we need to bring to 3 lows. So what is the plan? The plan is, as Minister of Health, we need an intervention to break the cycle of societal factors and genetic factors that lead Trinidad and Tobago to be a leader where we should not be a leader. This crown that Trinidad and Tobago wears as a leader in diabetes, Dr. Hospitalis is laughing. This crown that we wear, this trophy that we have as being first in the region when it comes to rates of diabetes and so on, is a crown I do not want. That's a crown of thorns, my friends. So as we start to implement policy driven by data, and you are going to discuss the data, I am not going to bore you with data. But as I put my size 11 foot into my mouth, I will tell you, unless we get our 2 main groupings in Trinidad to understand that whilst you can't control your genetics, you can control your surroundings, and you could control this deadly relationship you have between your hand and your mouth. That is, you could control what your hand picks up from your plate and shovels into your mouth. That, my friends, is what you have control over. I'm a poster boy for diabetes. I keep saying that. Genetics tells me I belong to the Indian or the Asian racial grouping. Predisposition for diabetes. Genetics will tell me my 2 parents were diabetics and suffered horrendous deaths due to complications of diabetes. I can't help that. Genetics will tell me I'm male. Life will tell me I'm 58 years old. So I am an East Indian, middle-aged male, born of 2 parents with diabetes. Those are genetics. I can't change that. But what I can change is what I eat, how I exercise, and how I live my life. That is what I can change. But the change that we need, that cultural change, is so difficult to drive down to the population that it makes physicians go berserk. Any physicians in this room who have to plead with their patients not to eat ice cream every day? Take your medication. And culturally, each Caribbean island has its own cultural nuances. Let me tell you what a cultural nuance is in Trinidad. The macho males in Trinidad have this feeling, if I'm going to line with the boys, for the foreigners here, line means hang out, go out with, whatever. If I'm going to line with the boys and I want to drink alcohol over a weekend, we have this feeling that all drugs interact with alcohol. So you know what the macho males do? They stop taking their diabetic medication on Thursday because they want to drink Friday, Saturday, and Sunday. Those, my friends, are the health policies that we have to change. That we have to change. Another factor is the social determinants of ill health, especially among the lower income groups. When you have a single mother with 4 children who works a minimum wage job, who doesn't have secondary education, who is not in control of her life, do you think she is empowered to make health decisions? The answer is no. How do we reach those people? And those are the type of health policies, not health care policies. Those are the type of health policies that we will be driven by over the next 5 years as we seek an intervention, a serious intervention, not in terms of medication, not in terms of amputating legs, but in terms of culture. Our culture predisposes us to this thorny crown in Trinidad and Tobago of being a leader where we should not be a leader. And we aim to do this over the next 5 years, not by short-term measures, by taking out an ad in the TV, and when the budget for the ad runs out, the program dies. That is what we have been doing. We allocate $250,000. Let's run some ads to talk about smoking, diabetes. And when the budget finishes, the initiative dies. And I'm happy to see that on session 3, Mr. Ian Horseshoe is talking about financing NCD prevention. That will drive the policy. How do we fund a long-term intervention program to break this cycle so that Trinidad and Tobago loses its thorny crown as being #1 in the region? So, ladies and gentlemen, I know you did not come to hear me talk too long. I think I've given you enough insight into my way of thinking. I think I can now take my foot out of my mouth and wish you a successful 2 days of deliberations. And I do look forward to seeing a summary report of your deliberations, which will inform government policy as we move forward. Thank you very, very much.
Okay, that is telling it like it is. Minister, thank you so very much for that very refreshing intervention. I think you have definitely set the tone for our 2 days' work going forward. And really, thank you very much. I'd like to also thank the other members of the head table that spoke this morning, Dr. Cummings, Dr. Leung, and Ms. Schultz Amy. I'd like to thank the researchers on the project. It's about 8 different organizations that came together to do the research. I'd like to thank the Secretariat that has been working so hard to get all the details in place for this meeting. And then I would like to thank the media for coming. I'm sorry you're all leaving now, but we know how it is. And thank you all for coming, and we look forward to the next 2 days of hard work. Thank you.